Our next speaker is Joel Griffith. Joel is a longtime KSPAN member, and he is also the chair of our Child Home Safety Committee. And he's going to tell you about the exciting project that we've been working on. So with that, no further ado, thank you, Joel.
Thanks, Steve. Okay. Here we go. Okay, so Steve talked about the extra lunches. I don't want a whole extra lunch, but if you want a sandwich, I will take your brownie. So I'm Joel Griffith. I am with the Child Fatality and Near Fatality Review Panel. Actually, I'm with the Justice Cabinet, and I work with the Child Fatality and Near Fatality External Review Panel. It's a group that looks at child deaths, child abuse and neglect related deaths in Kentucky. So that's kind of what brings me here and into the Child Safety Home Committee role. Also, I should mention Ashley and Steve have been key partners in this process from the beginning, so they will probably help me out if there's questions I can't answer or anything like that. I want to thank them. From the beginning, the Child Safety Home Committee has been a process involving partners, obviously KSPAN, the Child Fatality Review Panel, Prevent Child Abuse Kentucky has been involved from the beginning in helping us get the project going and implement the project, and we'll talk some more about that later. But we can't thank the panel and you all here enough for our work. I'm going to start with just a quick overview of what I'll be talking about today. And again, this will be like 10 minutes, so it will be short. I want to talk a little about the history of the Child Home Safety Committee and our current status, a review of kind of what we've done in fiscal year 2022, what we plan this year, and then just questions. This quote here is an unsolicited quote from one of the folks who received medication lockboxes, which is what we'll be talking about most today. And just, it was good to see this, that people appreciate the resources that we give them. And then we'll just end with some questions and things like that. So the committee was came out of me working on the panel, and working on the panel, we felt like, or I felt like, we didn't have an infrastructure to implement some of the prevention things that we thought we should be happening based on the data. This is just one piece of data that we used when we first began use the panel. That's a tracking of the number of cases reviewed by the panel that involved overdose or ingestions of illicit drugs by children, generally very young children. You can see that the pattern has been trending up. So we met with, or I talked to Steve and Ashley. We started talking, sharing ideas and data, and came up with the idea of a home safety committee, which should be focused on preventing unintentional firearms and medication ingestion injuries among youth. Again, particularly young children. That's the audience that we were seeing in terms of the panel. So as we started this process, we realized that there's a lot of kids, older kids, who are dying or being injured, particularly in suicides, with ingestions and or firearms injuries. But we deliberately focused on the younger population, recognizing and hoping, though, that the strategies we use to prevent these injuries in younger children will be protective factors in older children as well. So that was the beginning of our work. We first kind of had broad goals and things like that, and then this committee was set up, if I remember the timing right, just months before COVID. So then that kind of hit, and then the reality of just the limited time available and things like that, we've really, over the last couple of years, focused our efforts around distribution of resources to families to focus on prevention, that being medication lockboxes and gun locks. So we're in the process now of updating our strategic plan. And so our focus is going to be a little bit different than upcoming years. We're going to focus again on collecting data and just gathering trends. One thing I think we're going to see this year in the panel report, this is based on cases I review. We haven't gathered the data yet, but for example, I think we're going to see a significant increase in the number of children who die and/or are seriously injured by fentanyl ingestion. You read about it in the paper, we're seeing the cases as well. We're also going to focus, again, like I said, on our priorities is going to be distribution of resources. One of the things we've been working on too as well is collaborating with existing partners. We realize we're not the only folks around who are distributing medication lockboxes. And for example, UK, University of Kentucky Pediatric Forensic Medicine has a big program. We're working with them and tweaking our target audience as well. UK is focusing on MAT providers, needle exchange programs and hospitalizations. So we are going to be focusing on other family serving organizations. We've worked with them. So if they get requests from resources, they'll send them to us. If we get requests from MAT providers or other medical folks, we send them to UK just to avoid the redundancy. One of the things we hope to do is expanding our resource base. I'll talk about this more, but we have one primary funder. We are hoping to get more funds, particularly around gun lock distribution. I should back up a bit and say when we first got started, this would have been, I guess, early 2020. We were funded through KVIP and CDC funds. And I think we got, Steve, 500 medication lock and 750 gun locks, and we distributed those. And that went real well. And so that kind of led us down the path that we're on now. So, which is what I'm going to talk about next. Some of the achievements in fiscal year 2020. Our group was funded. We wrote an application to the Kentucky Agency for Substance Abuse Policy, and we're funded to distribute about 1,300 medication lockboxes. As you can see in the map, we made a goal of getting these delivered in different parts of the state, not just what we call the Golden Triangle, Louisville, Lexington, and Northern Kentucky. And we felt like we achieved that goal in terms of broad geographical distribution. Also, if you took a map of resources in 2022 and those ones I mentioned earlier, paid for by KVIP and CDC, you would see we reached even more, particularly in Eastern Kentucky. So we're pretty pleased with that. That was a objective we felt like we met. One of the things that we decided from the beginning is that with people received medication lockboxes or the gun locks when we had those, we didn't want them just to be handed to families. We love resource fairs. You know, you get people in rooms and you give them things they need and things like that, and they pick them off from the table and get information and go on. But we didn't want that to happen with the medication lockboxes because the research, and there's not a whole lot of it out there, but the research there is out there says that you get higher use if you are training them on how to use them in that face-to-face training session. So we distributed to partners who said they were able to provide that face-to-face. Part of that, we provided them resources to go along to do that training. One was the Connect brochure, which is a brochure that addresses ACEs and resiliency. We also gave them a tip sheet on safe storage, and we utilized the Prevent Child Abuse Kentucky Home Safety Checklist. We kind of like this because it's a good product, but also because it doesn't just address the issue of prevention of medication ingestions. It addresses pool safety and trampoline safety and all those kind of things. What we felt that does is it kind of takes the stigma away from this is not, home safety is not an issue that only applies to people with substance misuse issues. It's everybody's home. These things are happening in the homes of grandparents who've had kids placed in their care and things like that. So it really is a broad prevention home safety issue, not a substance abuse issue. Next slide. This is who our target audience was. We're not really necessarily target audiences. This is who we ended up partnering with in the 2022 distribution. A large part of them were Friskies, that's Family Resource Use Service Centers. You see the drug treatment needle exchange program, which we will back out of this next funding cycle. We also reached women's shelters, libraries, family counseling agency, just a broad spectrum of people that were able to do that face-to-face education piece, parent education providers, things like that. So fiscal year 23, this year we requested fundings again through the Agency for Substance Abuse Policy. We more than doubled the request and we were funded for that. So we'll be distributing over 3,000 boxes, and we are pleased that they funded that, and we're going to use the same model in terms of the home safety checklist, safe tips for storage and resources like that as they train or as they use to train parents. We've updated or will be updating the resources available that we're going to have on the KSPAN website. And Steve, I'm not sure, is that up? Is that up yet, the new website? Not yet, okay.
We're close.
So,
I'm hoping we'll be
whoops,
live before long, and it'll take us a little while to get it all.
okay. So, but we're working on that, so resources will be available for folks online. One of the things we also decided to do this funding cycle is, as we send out notices and let folks know that this resources are available, we're targeting HANDS, regional prevention centers, family resource centers, particularly because these are organizations that have administrative oversight agencies, and we are able to work with them to help distribute. By that I mean physically get the boxes into hands. It was quite a challenge, I guess, to have 1,500 medication lock boxes delivered, get them delivered to people all over the state. So we're hoping to operate more efficiently this year and get them distributed centrally. We worked with Steve Sparrow worked with Steve Cambron with DBHDID, and we have targeted the regional prevention centers to receive about 1,400 of these boxes, so then they can take care of the delivery process. It's not only easy for us, then we've wrote the project in a way that anything that we don't spend on delivering these things to local communities, we then will buy more boxes and distribute more resources with. We also want to do a better job surveying folks. We've developed a doodle poll and Survey Monkey, so that we will ask people what worked, what doesn't work, how can we do this better and more efficiently. This is just a picture of the lockbox. It's lightweight and portable, and it is also one of the more less costly boxes. These things are not designed to withstand a teenager with a sledgehammer. This is to create a barrier to lessen ease of access. And we're telling parents that, it's not just a matter of locking them, put them up and away. Don't let kids see them. So that's that dual message. And again, as I mentioned before, this will create decreased risk factors for adolescents who may get into drugs to experiment or with it, guns as well. Keeping guns out of the hands of kids, because if I'm out of my lane here, but I think that's the largest cause of teen suicide. Is that true, Ashley? Gunshots? Poisoning? Okay. From the panel's perspective, it's the largest group that we see in terms of our suicide cases. So where do you fit in? What we would like for you, if you are interested in distributing these resources, to email Steve. He has a running list, and we will add you to the list. We will prioritize available resources. The bottom line is we don't have as many as we need or we would like to have. So we prioritize them by geographical region and the agency's capacity to provide that face-to-face education to parents. But if you're interested in participating in this, getting medication boxes, email Steve and we will absolutely add you to the list. Don't not email just because you think maybe they won't have enough for us, because we use that data to help justify increasing our ask of our funders, saying, you know, we've got tons of people who want these, we don't have enough boxes. We,
The leading cause of 15 to 19-year-olds with active homicide by firearm and motor vehicle traffic crashes. The leading cause, followed by firearm, suicide, and
okay,
unintentional poisoning.
so, okay. So those numbers are why we chose the medication box issue and the gun box issue. We want you to share this information with others. If there's people in your community, parent education providers, parent support groups, wherever people can get these resources in the family's hands, and particularly high-risk audiences, we want you to get that information. Let those providers know they can contact Steve. We also want you to let us know about other efforts or resources. If you know of people who are distributing gun locks, medication boxes, let us know so we can connect with them and partner and figure out how we can coordinate our efforts. Also, if you want to join the Home Safety Committee, email me or Steve, and we will keep you updated. We have not been meeting regularly, but we hope to start doing that again and kind of start focusing on our strategic plan again. Whoops, I went too far. So the last slide was a thank you, and do you have any questions? I know it was fast.
Even if you don't have the lock boxes themselves, do you all still provide like educational seminar sessions? I mean, you could like use one as an example, but maybe not necessarily pass them out, or does the distribution of the lockbox go hand in hand with the education?
In terms of us, we would give you or whoever works in your community, no one's asked this question before. So Steve and Ashley, I don't know that Steve and Ashley or I have the capacity to go around and do trainings, but we will get you the resources in your hands or let you know where you get the tip sheets and things like that. The messaging is really pretty simple, and there's lots of resources out there. So it's just a matter of having a dialogue with family. And I think we would get you the information you need or get you access to it eventually on the website, so you can, community partners can figure that themselves. I'll get your question. Steve.
It's a great idea. I think if you want to be the spokesperson and lead the video, you're more than welcome to. We will try to see if we have any funds or anything to support such. We are really on a tight budget, but I think it's a great idea.
Yeah.
Especially if you're taking it to an agency who then gives it to all their managers, their clinical managers, or therefore that they can just pass that along and ensure that they're being trained properly.
But if I could also offer from Fatality's perspective, so we have a training on home safety. So the firearm protection would just be a portion of it, but we're happy to.
You could also, and you referenced the regional prevention centers on your screen. So they are, I'm with the division that's just changed names, Division of Substance Misuse. So these regional prevention centers are service providers, and they exist all over the state. So they are trained to do exactly the kind of thing that you're wanting to do. In other words, typically in a lockbox program, which we do, along with the distribution of the lockbox, there is an education component. and I would be happy to put you in contact with whoever you need in your area. As I said, it's a statewide network, so let's exchange emails.
So,
Joel, just to, I don't know if the slide was, but through virtual, the email for, if you're interested in receiving the locks, it's Steve, STEVE dot SPARROW@UKY.edu. Thank you.
there it is. And
We'll be sharing these slides too with everyone, so you the addresses, my email address is everywhere.
okay. And Jill and Steve, I don't know your name.
Oh, no, I was just.
Oh, well, I was gonna say, I was thanking you and Jill for offering, that's why this group works, is because we get in the room and figure out, hey, we can help you. Question back there.
Tied into the Safe Kids program at all? The Safe Kids group in Louisville and Lexington. And,
Yes.
they do regular, I wonder, we do in Louisville, they do a regular Zoom with all their community partners, they do an unlock distribution. This would seem like a plug-in that would fit nicely into their agenda.
Yes, if Steve knows the details more than that, but I think we have given resources to Safe Kids. They're also on our distribution list, and some Safe Kids folks attend our Safe Committee meetings as well. So yes, okay. So yes, you're right. It's a great resource and a logical partner.
And KSPAN can only work with our partners. Ashley is only on this project a portion of the time. I'm the only full-time person on this project. So definitely there's not much that we can do by ourselves. It's working as a network, with KSPAN, and working together that we are actually able to accomplish it. Through our great partners like PCHA, the Fatality and Near Fatality, through the Justice Cabinet, and through our many other partners.
Okay. Question?
Yeah, you said that geographical area plays a role in this, and I just didn't know if there were like specific areas you were looking to target next, or if pretty much anybody who just reaches out to you.
I think, well, anybody who reaches out to us, I think, should reach out to us. Steve, tell me if I answer this right. What we will do is, if we have 14 people from Garrett County asking, we're probably not going to give it all of 14. We will prioritize the reach, but don't not apply because you think we won't cover your area. We haven't made decisions yet about who will get funded in what areas. It just depends on who asks and how we do that. Does that answer that?
Yeah, I have contacts at Bourbon County Health Department with the HANDS program, so that's why I was asking.
Yeah, and HANDS is on our list of priority agencies or agencies that will work well for
I'll make
distribution.
sure they reach out.
Okay, thank you.
Appreciate it.
Thank
Any
you
other
all.
questions?